Hi, and welcome back to Focal Point AFR Talk. I'm sorry I ran out of time in talking with Jeff because Jeff is a guy that's doing his part. And if Jeff is still listening, look, I want to be sure that you understand I do not criticize or fault anybody for taking advantage of resources that are out there. That is not your fault. I don't blame you for that, anybody for that. If there's something that's kind of whopper-jawed about the system, then let's fix the system. But those that are using the system as it was designed to work, there's no moral culpability there whatsoever. So I have no criticism of somebody taking advantage of resources and opportunities that are there. But that's why I asked a question to Jeff there at the end. The guy's working 60 hours a week. He's got a large family. He's obviously responsible. He's not on public assistance. He's working hard to keep his family off of assistance. And I'm sure there's a deep sense of satisfaction for him that he's taking care of his family. He's not asking the government to rip off other people to help him. He's doing that himself, working hard with his own hands to provide for his needs and the needs of his family. And I'm proud of him for doing that, and I commend him for doing that. That is exactly the kind of spirit that's the essential part of the American soul and the American character. But see, what I would much prefer is to dismantle this behemoth of a federal government. You know, 2/3 of our budget is transfer payments right now. 2/3 goes into things like Social Security and Medicaid and Medicare and food stamps and housing. 2/3 of our federal budget is the redistribution of wealth. Now, we need to start trimming that down, trimming that back. And instead of spending that money on something else, let's send it back to the taxpayers, which means if we reduce government spending by 2/3, I mean, that's a couple of $1 trillion. That's more than $2 trillion. So if that $2 trillion goes back into the economy, instead of being sucked out of the economy, it's returned to the taxpayers. What does that mean? That means that Jeff is going to be able to generate a higher income. He's going to be paid a higher wage. He might be able to cut back to one job and be able to feed his family on 40 hours a week. And then all of the money, when he gets to tax time, all of the money that he gets to keep is money that he earned and that he was paid for honest labor. And I know Jeff would much prefer that. You know, back in the day, colonial period, you had to be a landowner, a property owner, to be eligible to vote. And I don't think that's a bad idea. And the reason was very simple. If somebody owns property in a community, they're vested in that community. If they're renters, they're going to be up and gone. Well, they could leave the next day. They have no tie to the community. They've got no long-term investment in the community. But somebody that owns property, he cares about the public policies that manage that community because it's going to affect his property. It's going to affect the use of his property. It's going to affect the value of his property. It's going to affect what he's able to do with his property. It's going to affect his family who lives on that property. He's vested. So he's going to have a real interest in seeing what kind of policies are adopted. But see, people that are not property owners, it's like people that pay no taxes. They've got no skin in the game. They don't care about the same things that somebody does who is rooted in the community. Now, I want to talk just for a second. 888-589-8840, by the way, is the number to call if you'd like to jump in the conversation here in the last quarter hour, 888-589-8840. You know, this Christie thing, the media beating this thing to death. I've got a story here from Newsbusters, who tracks this kind of stuff, Kyle Drennan, that NBC, you know, we've looked at these Obamacare numbers, and they're terrible. I'm going to play a Major Garrett sound. They're absolutely terrible. Only 24% of the people that are signing up for Obamacare are young people. They've got to have 40% of the signups be young people or the thing will not work. And these are just people that are enrolled. They've just picked a plan. We have absolutely no idea how many of these people have actually paid for a plan and are insured. You know, some of the evidence we've gotten is the numbers could be as low as 5 to 10%. Anthem, one of the major health providers in Connecticut, saying only 8% of the people who picked one of our plans have actually paid their first month's premium. 8%. So the fact that you have all this number of people enrolled means nothing. The only thing that matters is how many have paid their premium and are actually insured. So that's a huge developing story. But where the media went, NBC, for instance, spent 11 minutes on Christie 41 seconds on the horrible, very bad, no good Obamacare numbers. 11 minutes on Chris Christie for 41 seconds on the horrible Obamacare numbers. Now, you probably heard yesterday that one of the Democratic representatives from New Jersey, Frank Pallone, he's calling for an investigation into Chris Christie because they spent $25 million on these ads to tell the America that the Jersey Shore was back, come and shop here, resilient, we're stronger than the storm. And Chris Christie's family was in these commercials. And so this Pallone wants to call for an investigation into Chris Christie, misuse of public funds. He was up for re-election. This was horrible. This is engineering. Well, it turns out that the Obama administration signed off on all of that. The Obama administration approved of all of that. And it turns out that the advertising company was the one that picked Christie. Christie was recommending something else or somebody else. I forget the details. But even Chris Christie wasn't putting himself forward and say, hey, pick me, choose me. He had actually recommended somebody else. And the advertising agency, they were the ones that said, no, we think it needs to be you, Chris Christie, Governor Christie, you and your family. And the Obama administration says, we agree. So absolutely no scandal there whatsoever. But here is something that I believe makes Christie worthy of censure. Well, let's play a couple of sound bites first. Clip 15, Rob. This is Jay Leno. And remember when this thing happened, when it first happened, Chris Christie denied everything. I didn't know about this. I found out about it the same time that you did. I found out about it on the news, just like you did. I got to figure out why people close to me lied to me. And Jay Leno, clip 15, says, look, that's not a downer. That's a resume enhancer for somebody that wants to be president.
New Jersey Governor Chris Christie in the news, as you know. He doesn't know yet if he's running for president in 2016. I guess he'll cross that bridge when he comes to it. I guess. Well, this has turned into a huge scandal. Apparently somebody in Governor Christie's office, as you know, was involved in that traffic lane closure at the George Washington Bridge. It clogged up a major artery, caused a huge traffic jam. And the allegation is it was done in retaliation against the mayor of Fort Lee for not supporting Christie's re-election campaign. But Christie's denying any personal involvement. He said he was too busy clogging his own arteries at the time, and he couldn't. Pundits are saying this could hurt his 2016 presidential campaign. The ironic thing is, now that Christie is denying everything, he sounds even more presidential, doesn't he? That's what presidents do. They deny everything.
So Jay Leno is saying that's actually a resume enhancer for Chris Christie. Now, Chuck Todd, clip 16, trying to explain why the media is devoting 44 times as much energy to Chris Christie as to the IRS scandal. Let's listen.
He is a political star for the Republican Party. He's now the head of the Republican Governors Association, a lot of power there. So Democrats are going to work this story for a long time.
Absolutely. This is, welcome to the NFL. He has gotten a lot of benefit by being sort of this Republican rising star in the New York City media market, so he gets a lot of access to media attention, access to national media, and so he's had a free ride, if you will. Well, now, welcome to the vetting process. Now that he's essentially shown interest in being a presidential candidate, this is what life is like. This is what happens when the bright lights start burning.
So Chuck Todd says, hey, look, this is just part of the vetting process. Get used to it. Be a man. Don't whine. Don't complain. Do you remember anything like that with Obama? Where was the vetting process with Barack Obama? It was non-existent. Chuck Todd and the other folks over there, MSNBC, were out there cheerleading for Obama, not vetting him. One last clip before we go to the phones, 888-589-8840. Drop back to clip number 10, Rob. This is Major Garrett. Oh, one thing before that, where Chris Christie is worthy of criticism is he signed a ban on reparative therapy for homosexual teenagers. Chris Christie said, I'm going to make it a crime in my state to help a teenager who is struggling with unwanted same-sex desires. You got a teenager, he has unwanted same-sex desires. He wants to get control of that. He wants to deal with that. He doesn't want that to master him. Chris Christie signed a bill that says, you try to help that kid, I'm going to put you in jail. If you're a professional counselor, I'm going to yank your license from you. That's what Chris Christie did. That just burns me no end. So I think that's something that Chris Christie can legitimately be criticized for. Now here is Major Garrett on the horrible Obamacare numbers. Let's listen.
New enrollment figures are raising concerns for President Obama's health care program. Officials say the numbers confirm that not enough healthy young people are buying insurance. Major Garrett is at the White House. Major, good morning.
Well, good morning, Charlie and Nora. Here's the big number. 2.2 million Americans have enrolled in Obamacare through the end of December. And for the first time, we know the ratio of those consumers. Right now, 24% are aged 18 to 34, 33% 55 to 64. This is important because outside experts have said Obamacare economics only works if about 40% of those enrollees are in that category 18 to 34, younger, healthier people paying into the system. The administration at the highest levels say they have just enough of those young consumers in the system for Obamacare to survive economically. But there's a couple of other pieces of data we don't know. We don't know how, for example, how many people, not just who've enrolled, but who've actually paid for coverage. This matters because there are anecdotal stories of people being denied services at hospitals from pharmacies or doctors because they think they have coverage, but there's no record of it. The last thing we don't know, Charlie and Nora, is how many people had insurance coverage before who are part of this new enrollment data, because what the insurance company needs is people who are uncovered, not paying in the system, to join. The administration hopes to have better data on those two categories soon.
That's Major Garrett, catastrophic numbers for Obamacare, and I want to apologize to our callers. Drew, I really want to chat with you. I hope you get a chance to call back tomorrow. If you call back tomorrow, Drew, he's at Camp Lejeune, North Carolina. He's a Marine. I really want to hear what you've got to say, Drew. So I'm just out of time for today. Please call us back tomorrow, and we will put you right to the front of the queue. Iris in Dallas, Texas, please call us back tomorrow, and we'll get you to the front of the queue. Well, that's it for today. Do not forget, my friends, to bow low before God, stand tall and unapologetic before man, stand in the gap where God's placed you, and never forget, with God's help, we are fighting a winnable war. God bless you. See you tomorrow.
The views and opinions expressed in this broadcast do not necessarily reflect those of the American Family Association or American Family Radio.